Now we're looking at the insides of a thoracic cavity. We look at two lungs, the left and the right, as well as a heart. The lungs will occupy a left and a right pleural cavity, and the heart resides in the mediastinum, which is also where the great vessels reside. The left lung and the right lung have a fissure, a groove that separates an upper and a lower lobe, or separates them into two. It's right here on the left lung. On the right lung, it's right out here. The right lung also has a transverse fissure, or horizontal fissure, that goes horizontally, and splits the lung into three lobes, not just two lobes. So on the right lung we have a superior, a middle, and an inferior lobe. On the left lung we have a superior and an inferior lobe. When we open the lungs, we can see the heart sitting very closely in it. The heart is situated normally a little bit to the left. So this part here, that the heart presses onto the left lung, we call that the cardiac notch, or the cardiac impression. And then we have an area that you can see right here, that where the vessels enter and exit the lungs. That's known as the hilus. We have an artery that goes in. The artery brings blood from the heart. In this situation, it's going to be the pulmonary artery, but it's going to bring deoxygenated blood. So it's going to be blue. And then we have oxygenation happening in the lung tissue, and the vein will carry the oxygenated blood back to the heart. And that will be called a pulmonary vein. Then of course we also have a primary bronchi that enters the hilus. Once it enters the hilus, the lungs, it will create a bronchial tree and will branch out many times, about 23 times in all. Once the tracheal cartilages are here, but once the hyaline cartilages are not there anymore to keep the bronchi patent, we will call it a bronchiole. At that point, all we have is smooth muscle and an epithelial membrane towards the lumen. The respiratory system a little bit on the cadaver. We have a right lung and we have a left lung. Right here, the left lung is rather small in this specimen. When we look at the right lung, we can see a large oblique fissure, and then on the upper lobe we can also see a horizontal fissure that's much smaller and not as deep, making a superior, middle, and inferior lobe on the right lung. The visceral pleura is right on the lung tissue, and the parietal pleura is on the chest cavity. This is a collapsed lung because there is air in between the visceral and the parietal pleura, making the lungs recoil and collapse. When we now look a little bit at the upper conducting zone, particularly the larynx, we can see here the thyroid cartilage. Below it, right here, is the cricoid cartilage. Underneath that, what we can actually see is the thyroid gland, right here. As we move inferior in the back of the thyroid gland, actually at the level of the thyroid gland is really where the trachea begins. And we can see a couple of these rings. Right here is a ring, cartilage ring, hyaline cartilage we have. And here's another ring. In between we have the annular ligament. As it goes further down, at about this level, we have the carina. We cannot see that split, but what we can see nicely is the hilus as the vessels enter the right lung. one more interesting thing on this cadaver is that we can see the vestibular folds deep inside, and we can see the glottis, and we can see here the epiglottis. The epiglottis is not hyaline cartilage, but it's elastic cartilage. So we can see as the larynx moves superior, when we swallow, the epiglottis will close down the glottis. Posteriorly to that, we will have a tube that looks collapsed right now, but I can put a probe in and I can make room, and that is the esophagus, which makes us understand why the thyroid cartilages are C-shaped and there's none in the back. So when the food goes down, it can push the esophagus into the trachea a little bit and not push against the vertebral column, which lies right behind. This here is bone. Actually, this is a disc, this is a vertebra. There's ligaments on top, so you can't really see it. Bone to bone, actually. You can't see that. But what you can understand, if there is an outgrowth on this bone, if like we have arthritis, it will press on the esophagus and make it harder to swallow.